I've been in touch with the infectious disease physicians at Cincinnati Children's, and because they are local and they have an idea of sort of what's going on right around us, I'm really deferring much more to them. So David and I did change our policy in a couple different places regarding suspected or confirmed cases of COVID. And we really did that to make it more cautious than the current recommendations that are out there. Because we recognize the science is not perfect. I mean, we totally get that there's just so much we don't know. And as he said, we're not closing the door on any options available. So really, I would encourage everyone to share thoughts and ideas, because the good news is we're committed to adjusting this policy however we need to adjust it to make sure that we're all safe. The bad news about that is the policy might change, but we will, explain any and all changes and make every effort to make sure that everybody is updated on that. It's kind of interesting if you look at New Zealand, which just came out with an article about how they've gone 101 days without a positive case. The key for them has been contact tracing, appropriate quarantine measures, and social distancing. That's how they managed to achieve that. So I was thinking about that this morning. We are a small community, and if we are all committed to practicing the social distancing and looking out for each other as we do, as we always have as part of the Bethany community, and we cautiously keep kids home when they're sick, and the school does its part to be very transparent about what's happening at the school, I think we could actually achieve what other schools maybe will have much more difficulty achieving. So with that being said, I wanted to just, David, do you want to go ahead and put up
Sure.
the plan, and I'll just walk through some of our changes.
I have it here on page 10 right now, that section
perfect.
on managing.
That's perfect. So a couple things. One, in the event of a positive case, one of the first things we will do is reach out to the Hamilton County Health Department, and the Hamilton County Health Department will actually come in and perform the contact tracing. So they will do all the contact tracing. They will then ensure that everyone who was considered in close contact with that person who has COVID has been notified and will guide us on quarantine measures. In addition, the school will notify the entire Bethany community if we have a positive COVID case. Now, we can't obviously give the name, but we will give the grade level so that everybody is aware that we have a case, because we do recognize that in the case of lack of information, we're going to create more panic, and that's understandable because there's enough panic to go around anyway these days, because so much is changing so fast. So we will notify everyone if there is a case. In addition, anyone directly affected would be notified. Let's see. Okay, so I'm going to jump ahead here real quick. So we've changed the number of days to return to 14 days. So that was 10, and I know that made some people nervous. So if I look at the data shows that there hasn't been a whole lot of transmission seen after day 6. And there was another study that found that there wasn't a virus that could really replicate itself after day 9. I think that's where the 10 days came from. But again, I don't think it's very reassuring to anyone when we say, yeah, there's only like a 1% chance, because then the rest of us feel like, oh my God, I'll be that 1%. So I get where the science is, it's numbers, but it doesn't really resonate when you're thinking about your family. So to be safe, we're just going to take that out to 14. And I just want to mention the data, because since the data does show that this is, that there's very little transmission between day 6 and 10, I think if we go to 14, we're going to be quite safe. We are also changing the fever-free time back to 72 hours. And part of that comes from a parent really very nicely explained to me that, there sometimes as a parent, you've got many, many other pressures in your life. And if there's any sort of confusion on what 24 hours is, and you don't quite get it right, you could end up cutting it too short. If you put 72 hours in place, that should really give us plenty of wiggle room for confusion on exactly when the fever-free time was. So we'll go back to 72 hours. But the other big thing I want to throw in here is that we're not letting anyone who leaves this, who has an illness or who has been quarantined because of COVID, to return to the school without a doctor's note. And I'm going to add, David, there's one thing I think we should add, and that is I think the doctor's note needs to specify a date of return. So we actually talked about this at my practice yesterday. We don't want to just give out the note that says, hey, you can, Johnny can go back when Johnny's, been well for 4 days. Well, what does that mean? Well, for 4 days. So I think we really need to ask for a specified date of return on the notes. And I think that will help reduce confusion and concern about people returning too soon. So the other change on here is, and this is a big one, it's not a change, I'm sorry, this is the same thing. We really, really need students and families to let us know if a student tests positive. I mean, that's really critical to all of this. If we know, we can take measures, we can minimize spread. If we don't know, I mean, that makes things so much more difficult. And then David and I tried to put together some parameters or triggers on when will the school close. This is really challenging. There are really no guidelines for schools on when they should close. A lot of schools in their plans have said we will contact the local health department. And the local health department really does not tell a school when they should close. They don't actually give that guidance. And by the time you reach out to them, it's probably already pretty late. So we tried to come up with, and this is probably an area that we're going to have to keep working on. We totally recognize that these triggers are probably going to need a little bit of work, but at this point, what we came up with, if we have more than 3 groups of students who are requiring quarantine at one time, and then we went with 10% of the school population, that might be high. We may have to bring that down. And then the other thing was other circumstances. So there could be situations where if we have 3 or 4 faculty members who are out, we may need to close at that point, just logistically. So it's difficult for us to nail down exactly when, but we're trying very hard to give you at least some solid numbers. But I feel like the key here is we're going to we will be as transparent as we can without sharing, personal HIPAA data and names, to at least give everyone an idea of what is happening at the school so that you guys know, are the infections going up? Are the rates going up? So let's see if there was anything else. That's it. Yeah, no, I think that's it. That's all I've got. I can answer questions.
Well, let me stop sharing here, Parl, and I can always, if any of you would like for me to go back to the policy, I can certainly do that. I did get a number of Q&As, some of them coming in late last night and early this morning that really had nothing to do with the medical aspects that Dr. Bala referred to. And so we can certainly make our way through those. And but I can also do just what I've done in days past, and that is make sure that I respond in written form to all of these questions, and then that I share those with you as well. And so I can, again, share the link to the reopening plan. I can share the written responses to many of the questions that you posed, or if you get the question answered here today, that'd be great on the Zoom. And I'll also add the recording of this particular meeting. I pressed record probably about 10 minutes into my remarks, so I apologize about that. I'm sorry, Parl?
Oh, David, I was just going to mention, I think you've made it so that every time people click on that link, they go to the most updated version.
Correct.
Right?
It's a Google Doc, and so it's live, so people are have the ability to be able to see what's the most updated. In the past, we've PDF'd it, and if you've clicked on any of our past Blue Hawks blasts, formerly known as our Thursday emails, you may have gotten an older version. So we want to make sure that anytime you click on the reopening plan, that it is the most updated, most recent version that we have. I'm going to start. I see a couple of our
We have
people
two
have
hands
learned
up.
how to raise their hand virtually in the Zoom meeting. So I see Angela Phillips there. Angela,
Hi, good morning.
morning.
Good morning. Thank you, Dr. Bawa, for explaining that. That was very helpful. It does sound like there was a lot of consideration that was taken, and I liked how you talked about, just the difficulty and the frustration. So that feels good. My main question is really regarding not having a requirement for a negative test. I've looked at some other schools, particularly schools that are very similar to Bethany that have a small student population. I know for my current employer, there's also a requirement for a negative test. And so I just wanted to understand why there's not a negative test included, particularly with a doctor's note in terms of a return date. I think for me, the biggest is that this person is no longer contagious. Unfortunately, I do have direct experience with people who have had COVID, and I know that they've had COVID for an extended period of time. I also know, as Nurse Lance had mentioned, just in terms of the reliability of the tests, but there's nothing that can prevent you from taking multiple tests. And so I think it's highly unrealistic that you constantly take a test and get a false positive for 6 weeks. So I just want to really understand why we wouldn't be, in the spirit of being cautious, have a negative test that would then say, okay, this person is no longer contagious, because that's really what the concern is that they're contagious, not necessarily that they're not sick.
Yeah, no, I think you're right. I hear you. And I don't want to get into the weeds on this one too much, but you're right. This is where it gets really tricky. And a lot of this comes down to the limitation of the testing. And that's what's incredibly frustrating. But the test, so that there are two types of tests. There's the antigen test and the PCR test. The antigen test is truly not very accurate, as Governor DeWine was an example of this past week. The PC, at least according to Cincinnati Children's, and this was from a webinar that I participated in just about a week and a half ago. The PCR test is really felt to be the most reliable, and that is the test that they're basing all of their information on. And you'll know if you've had that test, because that's the test where you feel like they're biopsying your brain. I mean, that's the really invasive test. I mean, not truly invasive, but it's a little bit more harsh than the antigen test. So the issue is that the PCR test will be positive if it picks up any genetic material of that virus at all. And so it's almost an overly sensitive test. And that is part of the reason that everybody has moved away from testing as a way to document that somebody is safe to return. So that a lot of this is based on experience. And I will say a lot of this experience is coming from other countries as well, from Italy's experience and Europe's experience in terms of how long people actually are shedding virus that can be passed on to somebody else and cause them to become ill. And in this case, unfortunately, the PCR test is not an accurate measure of that. The truly accurate measure of that seems to be based upon symptoms and time. And so I understand that's not 100% reassuring, but that is part of the reason that we are moving away from testing, because a test is not going to necessarily, because tests have limitations, because you can have false positives and false negatives, it's not going to be a true measure of whether you're safe to return. I don't know if that helps.
So one question, so with the doctor's note, to clarify, along with the date, will it also state that this person is no longer contagious? Will the doctor be able to state that on the note?
At least when I write my notes, that is what I write. Is that,
can we require that for the doctor's note, to require that information? Because that's really what we're concerned about.
Sure. I mean, like I would say, like if I wrote it, I would say this patient can return on X date, after which they will no longer be considered to be contagious.
Okay.
With that, yeah.
I think that needs to be there, because I think that puts another level of caution, particularly when the parent and the doctor are conferring and you're looking at what's happening. And the reason why is because, at least from the information that's being put out there, children can spread, but they may not necessarily be ill. They can spread and they may not be sick. So then if you're not measuring a test in terms of the PCR, in terms of, if they're positive or negative, then to me, it seems like you're monitoring their symptoms. So then it conflicts with me if you're monitoring symptoms and I can still be asymptomatic and spread. So I'm monitoring things that don't necessarily say that I'm not contagious, because if I'm asymptomatic, I don't have any symptoms.
Right. No, you're totally right. And this is where I think there's been, this is a very confusing area, and it's gone back and forth. At one point they said, you really don't spread it asymptomatically, and then you do spread it asymptomatically. And so what I can tell you, and I will completely admit the science is not complete here, but what we do know is that you are probably shedding and spreading the virus 2 days prior to when you show symptoms. So that is something that we will take into account when we do the contact tracing. So you can shed it up to 48 hours prior to when you actually start showing symptoms. Now, Children's Hospital has been testing every child who is going to have any sort of operative or surgical procedure. And so they've been doing that since they started doing surgeries again in May, I think. So they have a fair amount of data on those kids, and at least what they are finding is very few cases of people just being completely asymptomatic and positive for COVID. They feel, at least based on their experience, that they are not seeing a lot of this asymptomatic spread. I don't know. I mean, that's what they're saying. I do also think that a lot of these cases that you hear about where people say it was asymptomatic, some of these COVID cases are so mild, I don't think people recognize that they have symptoms. So it's not very helpful to us, but I don't, so there can't, a little bit of fatigue, a little bit, a low grade fever, adults especially may kind of blow that off. So, a headache, gosh, anybody could have a headache given the stress of COVID. So we may not necessarily equate that with a symptom, but it could be mild. So you're right. I think, I'm going by children's experience and again, this comes back to us being a community. And, this is one of those times where we're going to say, look, if you are feeling at all ill, you need to stay home. At least in the medical community, we've always had this thing where, if you're sick, you still have to go to work. You're a guy, come on, you're a soldier, you're supposed to keep powering on. We have to change that. If you're feeling ill at all, you got to stay home. If your child is not looking right to you, you're concerned, you just have to have a very low bar to keep them home and keep an eye on them. And part of, checking temperatures every day is at least something. It's not perfect, but that's at least something we can do. Asking these health screening questions, it's something. So I hear what you're saying. I think we can definitely specify that on the doctor's note. And I think we'll just keep watching the data. And if we find out otherwise, maybe we do shift this back to testing. Kind of have to wait and see.
I think that would be helpful, because I think that, like you're saying, there's so much information coming in, then the doctor who is treating that person can then decide if they want to say this person is no longer contagious by having a test or not. So now you're putting that level of risk and understanding about being contagious with the doctor, and they know the history and they know all of the information probably more readily. And so I think that high level of accountability to the doctor is what we need to require on the note.
Yeah, I agree. I totally agree. And there are going to be circumstances, I'm sure, that I will come across clinically where if I have some doubt of the timeline, I'm going to push the date out further. If it's just not clear, or if you get the sense that the parent's a little bit wishy-washy on when it actually started, we can get that sense when we're seeing them, and then we can push the date a little bit later. So I'm hoping that between 14 days, 72 hours, and a actual doctor's note, we're going to minimize the chances that we're bringing somebody back too soon.
Thank you, Pearl. I see Creature on the Barnyard's hand up.
Hello, thank you for all this information, and I really appreciate some of the changes that have already been made in regards to just transparency with informing and things of that nature. My question is regarding prevalence. I know a lot of decisions that have been made regarding policy and that kind of thing has to do with known prevalence, known cases in a given community. The first part of the question regarding that is, are we aware of what our current prevalence or incidents in new cases or cases in the Glendale community at large, and also in the Bethany community among the children, the students that we do have we done any surveillance, have any information about any known cases in our given community currently?
No, we haven't at this point in time. And really, really what we're doing right now is communicating with you folks and communicating through this reopening plan that we need to make sure that, number one, you don't send your child home sick, and that if there is any information that you have regarding any sort of contact that you've had within your family with COVID, that be shared with the school so that we can work together in making sure how best to keep you and your family safe, as well as the community at large. Glendale, I know, did get its first case sometime in, I want to say, late May or early June. And I am not aware of any more cases other than the one or two that have been reported at this particular point in time. I don't know, Krishana, if Hamilton County Health, given the fact that they have a higher landscape view of the county and the surrounding area, if that would provide more awareness, at least from a community-wide standing, to be able to do that.
Actually, Krishana, thank you for asking that, because that reminded me, David. I think I've worked out something. When I was talking to Karen, we probably need to add another trigger for us to close, and I think that would be if Hamilton County went to purple. At this point, I'm very confused as to what government official would say schools have to close. I don't really understand how that works anymore. But I think as a school, we could say, it seems very reasonable to me that if Hamilton County is purple, we should probably all be staying home. But when you said prevalence, that's what made me think of that.
Thank you. The other.
Krishana, I think you have muted yourself.
Oh, sorry. I know sorry, thank you for letting me know, David. The documents that we turn in for, health and things like that, it may be a little bit late to ask parents some of these questions, but I don't know if we had some baseline questions that we could ask parents so that we could do some tracing in real, like, time it in a certain way, so that maybe if we had some information about, how many people were out of town and what time frame have they been out of town in, and then, if they have family members who have had, a positive test. I don't know if that kind of information would be helpful. I know it's a lot of information, but from the tracing standpoint and just understanding, because of the fact that we know that children are often not symptomatic. So symptoms are not going to be the only way that we're really going to really understand this as it relates to children. I think that even the body of literature that's even out there is just not, it's just not there to understand how children experience this illness. What we understand, though, is that they are so highly contagious, like anybody else who has it, and everyone then is just a susceptible host. And so I guess my concern is just, getting as much information about our children and our community as we can, so that we can know in more real time what's really happening, just because of the fact that if we're not necessarily retesting to say negative, then, I mean, some kids, I know some people who have tested positive just tested positive because of the tracing alone. They were tested because of the fact that there was a concern based on tracing.
Mm-hmm.
I should also throw out, this is one of those weird circumstances where actually, at least what they're finding is adults are a little bit more efficient at spreading this than children. But your point about asymptomatic carrier, people who test positive and are asymptomatic is very, very true. Very well taken. I think it's just, this is a small difference from, it doesn't appear that this is as rapidly spreading in amongst children as maybe some other viruses do. It absolutely spreads amongst everyone, But interestingly, especially the young kids, at least the data so far doesn't seem to show that the young kids are as efficient at spreading it as maybe older kids and adults.
Krishna, I've added a note here to myself about questions to parents regarding COVID contact. If you don't mind, I'd like to talk to Parl about this, after the meeting, as well as with Krista Lands, to see how something like this might roll out. But I appreciate you offering up the suggestion very much.
Thank you very much, both of you. Thank you.
Mary Barrera, I see you have your hand up. Mary, you're muted.
I had just put my hand up to make sure you saw that was an option. I think I was probably one of the first ones to put it up. So I don't have any questions. I just was saying that's an option to collect. So
okay.
Thank you. Great job so far.
Yep, thank you. I see that Eric Austin has his hand up.
Yeah, hi, David. It's Terica. Actually, I logged in under Eric.
Hello, Terica.
Hello. All right, just two quick questions. One is a clarification question. I saw where you have the policy you would shut down if there were 3 groups of students. Can you just confirm what that means? Is that 3 kids in the same grade, 3 kids in lower school, middle school? What does that mean? And then I'll ask my second question afterwards.
It means all the above. In talking with Parl last night, as Parl mentioned, coming up with these sorts of triggers is very challenging. And so my assumption, and Parl, you step in after I speak, that if we had 3 groups of students, let's say in 3 different grades, yes, that would mean that we would look at closing. If we had 2 groups of students and a group of faculty have it, who've been on campus, we would close that as well. If we have 2 groups of students and then a group that was somehow involved in, let's say, Power of the Pen activity after school, that would cause a trigger as well. Does that clarify your question?
Oh, so it's really 3 students or more. It's not necessarily a group. So it's if 3 individual students. That's what I'm trying to. The group is throwing me off.
Well, no, it actually, I would say no. So let's say in 2nd grade, you've got, you could have a situation where like a couple kids turn positive, around the same time. Then that grade and anybody else associated with that grade, however the contact tracing works, those people would all be quarantined. That would be in my mind, that would be one group. And then in another grade, if that happens, that's another group that's quarantined. And then, so it's like if you have 3 groups throughout the school that have had to go into quarantine, that would be the trigger in my mind.
At separate times, Parl, you're saying?
I'm saying at the same, so like at a given time. So
right, but one group goes in at one Monday, another group goes in at Wednesday.
Right. So like by the time we get to the end of the week, maybe one's about to come out, but we've got 2 groups in quarantine. It's still 3. That would be a trigger.
So maybe if you guys can just clarify that a little bit better in the documentation, so we know what that means.
Yep. No problem.
And then my second comment or question is, everything in the document says student, but I am assuming this is for student and staff. So could you add staff into the documentation, because they would need to go through the same things that students would need to go through as well?
You're totally right. Actually, that was the other thing Karen pointed out to me. When we say the percentage, which I think we've still got to fiddle with, it has to be the entire school community. So it's going to have to include faculty and students, because if you've got 4 faculty members who are testing positive, that's pretty significant too. So yeah, you're totally right. We got to add that.
Just to interject real quick, I did talk to.
I'm sorry. Hello, Krista Lands, our school nurse.
Hi.
Make sure everyone knows who you are.
I did talk to our contact at the Hamilton County Department of Public Health, and he said that by the end of this week, they should have more set guidelines for schools. So I was super excited. Let's hope that happens. But when it does, I'll get that to you guys so you can update whatever guidelines they give us.
That's a pleasant surprise.
Thank you, Krista. Jenny Wallen, our academic dean, I see you have your hand up.
Morning. I just had a couple of questions regarding the kind of three groups. If we have a student that tests positive and we have to quarantine their class, their teacher, any teachers that were around them since our teachers are traveling, do we also need to quarantine the class of any siblings that they have? And is that considered still one group or two?
That's a good question.
Yeah, I think that was my question.
So, yeah, this is where it gets really confusing. This is why I thank God the Hamilton County Health Department will help us with this. But essentially, let's say you have, Johnny in second grade test positive, and Johnny has a fourth grade sibling. That sibling, so if that sibling has no symptoms, and that would have to be a more, a more specific review with that child to make sure. But if that child truly has no symptoms, that sibling has to quarantine, but all the people around that sibling do not have to quarantine unless that sibling ends up testing positive. So it's I kind of try to think of it like it doesn't skip. So it's everyone who has been in close contact with the one positive case, but you don't have to quarantine everyone who's been in close contact with the people who have been in close contact with the positive case, if that makes sense.
Yeah.
And so then you were asking about faculty. I think it'd be the same way. So any faculty member who's had close contact would have to quarantine. But then unless they test positive, we don't have to quarantine beyond that.
Mm-hmm.
Now, did I?
I guess my question is because our special area teachers will be traveling in particular, what we're deeming as close contact and not close contact.
So close contact by definition is within 6 feet for 15 minutes or more.
Okay.
Regardless of what, I mean, even with a mask, within 6 feet, within 6 feet for 15 minutes or more. So that's going to end up being, I mean, I would personally say we should be quite cautious and generous on that. So, I mean, I'm not going to feel 100% comfortable saying, well, that child sits across the room, so we don't really have to quarantine that child.
Right.
Knowing the way kids behave, I think, we're not going to be so strict on the 6 feet.
That makes sense. Yeah. And I know I just got an alert that Governor DeWine will be on today to talk specifically about schools. So,
ooh, well, I don't know how many of you heard that the governor in Kentucky has already decided that all the schools in Kentucky are going to go remote through the third week of September 28th, I think.
Thank you.
No problem. I want to throw in one quick thing. This is a fun fact, maybe not. A lot of schools you probably have heard are using the 3 foot as their rule. Just so you know, Bethany we are doing with 6 feet. I wondered what the origins of the 3 feet, what is the origin of 3 feet? Apparently, when the WHO had issued their guidelines way back at the beginning of this pandemic, what their research showed is that 1 meter, because we're the only people who seem to not follow the metric system, but anyway, one meter and close contact with 1 meter was considered risk. They said if you can be beyond 1 meter, it's good. If you can be beyond 2 meters, it's even better. So the CDC, when they decided to adapt that for us, decided to just go straight to 6 feet because their rationale was if you say 3 feet, people are going to be 1 or 2 feet apart. If you say 6 feet, they're probably going to be about 4 or 5 feet apart, and that would be better. So just so you know where that's all coming from.
Being a doctor, I guess that would be a fun fact for you. But
sorry, it's probably not fun for anybody else. Sorry.
Rochelle Hackworth, I see your hands up.
Hi, good morning. Can you restate what you said about the sibling? So if a child tests positive and they have a sibling in another grade, what can you just restate what you said about the sibling?
Sure. So if a child tests positive, that child's sibling has to quarantine automatically for 14 days. If that child develops any symptoms and tests positive, then everyone that child has been around would then have to quarantine. So what I'm saying is you don't automatically have to quarantine all the people who have been in close contact with a person who was in close contact with a positive. Am I making sense?
It does, but I'm just also wondering if a domino effect is going to occur too because of that child that's not the sibling, but a classmate of the sibling has to quarantine. Then does the sibling of the classmate sibling have to quarantine?
Okay, so what you're saying is, let's say Johnny in second grade is positive. So Isabel, who's a classmate of Johnny's, is going to quarantine. But do Isabel's siblings have to quarantine? Is that what you're asking me?
Okay, so let's just say Mark has the COVID or has test positive for COVID. Mark has a brother, Teddy. Teddy has a classmate, Isabel. Isabel has two sisters or in a different classes, but Isabel now has to quarantine because Teddy has to quarantine. So does Isabel's sisters now have to quarantine?
No.
Just Isabel.
Just Isabel. So basically we're quarantining anyone who's had close contact with that positive case.
Okay.
So, but not beyond that, because truly then it, the siblings have not had close contact with that positive case.
And this is all assuming the siblings are in different grades.
Correct.
Okay.
Parl, could you carry that one step further? Let's say that Isabella is quarantining and she has two sisters at home. What does quarantining look like at home for Isabel?
Oh yeah. Okay. So this gets interesting. So this is where you're going to want the doctor's note in place, because what's the challenge for us is how long do you quarantine? So if just to give you an example, if a parent comes down with COVID, or actually let me do a child. If the child comes down with COVID, the quarantine times are all based on the fact that that person is isolated from spreading it to others. So if it's a young child, a parent can't isolate that child and not be around that child and not care for that child. So the parent's quarantine time would be the entire time that the child is ill until the child is released from quarantine. And then the parent has to go another 14 days after that. So the idea behind this is when somebody is ill, they could theoretically transmit it to you anytime over a 10-day period. When the child is no longer considered contagious, according to health officials, which would be 10 days, even though we're using 14, when that child is no longer considered contagious, that parent who's been around that child the entire time has to now go another 14 days beyond that. And anyone else who's been around that child has to go 14 days beyond that of quarantine time before they can be around other people. So that's where having a physician's note is going to be helpful, because there are a lot of intricacies to this and figuring out, did you really socially isolate? How well could you socially isolate? And then determining the quarantine times based on that.
Thank you, Parl. Angela Phillips, do you still have a question? I see that your hand's still up.
No, I must not have taken it down.
Oh, I'm sorry, Nalita Lewis. Yes, you had your hand up a little while ago. Go ahead, Nalita.
Yeah, so my question gets answered, and then I have a follow-on question. So if the parents are quarantining for exposure to that child that's tested positive, the siblings would follow the same protocol, correct?
Yeah, but again, it's going to depend on how old the siblings are and how well they're able to isolate them. So if you have the ability to keep those siblings using a separate bathroom, sleeping in a separate area, eating separately, and not being around the person who has COVID, then that sibling may only have to isolate for the 14 days from the date of positive COVID for their sibling. But if they have not been able to maintain that isolation, then the sibling also would have to go longer.
And so we're leaving that up to the parent to disclose.
We're leaving that up to the parent to discuss with the physician.
Okay.
And the physician would then decide. And I as a physician, I would certainly not believe a parent if they told me that they socially isolated their 4-year-old. Some of this is going to also go back to the physician's knowledge of the family. understanding the family structure and how much they're able to do this, to isolate.
Okay. Thank you.
Sure.
Folks, we've hit the hour point right now, and as usual, I don't want to. I want to honor people's time here, but I also want to honor the questions that you folks asked me. And as I said earlier, some of them non-health related, given the conversations that we've had so far. So as I said, I will do my best to make sure to answer all these questions as succinctly as I can, and put them on a document and get them PDF'd and sent over to you as soon as I possibly can. If you can give me 24 hours, that would be really helpful. Let me just keep the line open for like another 15 seconds or so to see if anyone else has any questions or any particular announcements as we go along. I see a hand up here for Brittany Kelly.
Hi, can you hear me?
You can.
Oh, good. Okay. I just have a question about children that will be participating in extracurricular activities outside of the school. If a child was to test positive on that child's team, and then your, child has obviously come into contact, would the entire class still have to be quarantined based on, what happens? Because I know there are a lot of children that are still participating in, dance and gymnastics and kind of things like that. So I just wanted to see how that's going to work.
So you're saying like, let's say somebody has a dancer. I mean, so there's a dancer, she's going to dance class, she tests positive, so she's exposed to all the dancers, and she's exposed everyone at Bethany too that she's been around?
Correct. Or if she has been exposed and then she has to quarantine, would that class still have to quarantine because they have, been in contact with her or him, depending?
No, that's a good question. And that's where I know this is really confusing. If she truly does not have symptoms, then she would only be the one who'd have to quarantine. Her classmates would not have to.
Okay.
But basically, we're only quarantining those who have had close contacts with a positive case.
Okay.
And I should throw in here that Hamilton County is going to help with this determination. So I don't want you to feel like we're going to be putting all this on the parents to report or all this on the kids to say who they've been around. I mean, we will have the health department helping us, and they are experts in knowing what to ask and performing this contact tracing, because it's a science all by itself. So I've made it sound very simple, but I don't know that it's that simple.
Okay, thank you.
Sure.
I don't know if Rogel, Nolita, and Angela, who have their hands up, still have a question there. So if any of you do, go ahead.
No, I'm good.
This is Angela. Yeah, I had like a statement and then a question. So I thought this was very helpful today. So thank you. The one thing is that I think that what we talked about and the plans that we have in place, I think are very good. I know things change, and I know we referenced that the DeWine was going to make a statement today, but I would like it that if anything was recommended to change, that we really consult the community, because as we're all preparing to go back, having these plans in place and feeling comfortable about them is really, for me, the basis in terms of feeling that I can send my child back to school. And if any of those things change midstream, then it kind of puts you in a different position. Also, having these plans in place, I think, because there's a waiver that's in all of those forms, makes me think about it from that context. So is there anything in terms of if the waiver seems, something that, that you can't sign because it is more aggressive than, past years, given what's going on with COVID. So is there any kind of discussion or any guidance around the waiver that we should think about? Because I look at it in the context of what the plans are. And so hopefully if the plans are where we are today, then I may look at it in one aspect versus if they change. So how do we think about the waiver in the context of things changing?
Thanks, Angela, for asking that question. Let me just say a little bit about
David, can I just throw in real quick? Because I know
Yeah,
the,
go ahead.
the waiver is important, but Angela, I just want to throw in that I think your point is very well made. I will tell you that I don't think we should make any changes to the current policy that go in the less cautious direction. So we will not make a change to this policy that makes it less cautious without letting everyone know and consulting them. Would that be reassuring?
Yes,
If
definitely.
anything, I
Yes.
think we'll go the other
Yes.
way, but we won't let it become less, we
Oh,
won't make it more,
Perfect.
less cautious at least. So that way everyone can be reassured that, you know, we're not going to just sort of say, 12 hours, fever free, no problem. You know, won't do that. We will only go in the direction of more caution if if there's really some serious science that tells us we should go the other way. That would be a discussion.
That's very helpful. Thank you.
Sorry, go ahead, David.
Yeah, Angela, thanks for bringing up the issue of the waiver. Let me just share a little bit about the history of the waiver at Bethany. For many years, the only time that families sign a waiver of liability at Bethany was in two instances. One, when your child first matriculated into Bethany, whether that was kindergarten or 7th grade, there was a document that was signed at that point along with the contract. And that was the only time that you signed that waiver. If your child was there for all 8 years at Bethany or 4 or 5 years, it was only signed that one time when your child first became a student at Bethany School. And on individual field trips, there was another waiver that was placed for, especially those overnight field trips that we have with our older students, but even with our younger students, there was often a waiver that was put there. The waiver that is in the online forms that you folks received this year is a new way that we want to go about dealing with waivers in general, aside from COVID. And so it was a process that we consulted other independent schools to look at their waivers and wanted to make sure that the waiver that we put in place was something that was done on a yearly basis, so that families are aware of what the waiver has to say, and that it's not signed for field trips or just at the very beginning of a child's matriculation. So it's a desire on our part to be as transparent as possible about that. Now with COVID, we consulted with our school lawyer about, given the circumstances that we're in right now, do we need to make the waiver that we're rolling out this year have any specific language with COVID? And our school lawyer, very nice guy, very thoughtful, said it really doesn't hurt to have that COVID language in there. So that is not a waiver that is simply just for COVID, although there's COVID language in there. My assumption, my prayer, is that somewhere down the road, whether it's next year or a few years, the waiver will not need to have that COVID language. But given the special circumstances that we're in, that's where we are. Angela, does that clarify your question a little bit?
It does. It does.
I mean, this was, I think, an issue of poor timing because of, rolling out a new waiver in the middle of the pandemic, I think was probably pretty confusing. So it starts out with COVID language at the beginning. So I can totally see how there would be an easy misunderstanding of, is it just it looks like a COVID waiver, but then it keeps going. And I was a little bit surprised when David told me we never actually really had a waiver prior to this. David, did you also say you were going to skip the field trip waiver?
Correct. Some trips, for example, I can think of like the DC trip that the 8th graders take. That's actually organized by an outside entity that we pay for, and so oftentimes they might have a waiver that our students sign to be able to participate in that. And so in those instances, that's something that you'd be signing a second waiver, but it would not be a Bethany waiver, the second one.
But I think we had also talked last night about the fact that we're not having field trips this year. So why, I mean,
Yes.
Parents don't really need to sign the field trip waiver because we're not going to take any field trips.
Correct. And unless a miracle occurs between now and the end of the school year.
In which case we'll just give you the field trip waiver then.
Hey, David, just a question, because it does feel like a COVID waiver. So when I've referenced that waiver that Bethany has compared to some of the other independent schools waiver, they didn't have that. So it would be great to understand what independent schools that you benchmark that are doing the exact same thing that Bethany is doing from that waiver perspective. But then secondly, what happens if a parent chooses not to sign it?
Mm-hmm. Yeah, if that's a concern of yours, I'd be happy to talk with you, offline about those concerns, and I just would appreciate if you give me time to be able to consult with our school lawyer about the ramifications of that. But again, this is again a learning process for all of us as we go through. I know that it's something that is of concern for many of you, and I want to make sure that we're thoughtful and responding back to that to you folks about that.
Mr. Gould, I had a quick question for you.
Yeah, Beth.
I'm sorry, I can't figure out how to hold my hand up, so I'm shouting out. But I know that COVID is everybody's main concern. But because of where we're at today with COVID, when your child gets sick, the doctor's office doesn't necessarily want you coming right away to the doctor. And let's say this child has just a cold or a runny nose, or they're sick for, what would be a simple 24 to 48 hours sickness. And you call school and you say, my child's sick. Well, the doctor does not want to see this child. Do you just keep them home until they feel better? And I know like you want them to wait so long, fever free and everything. Is that where that comes in at?
I think this is every pediatrician office is going to have to find a way to evaluate these kids, because we all recognize that a cold could be COVID, strep throat could be COVID. You can actually have both at the same time. So I know we're not alone in our office, and all the other offices in the city are trying to gear up for how are we going to handle the flow, because we recognize the flow will be huge. So I would say as a school, that child still cannot come back until there is a doctor's note in place. So the doctor's going to have to figure out how they see that child. And where a lot of us are using telemedicine, there are a lot of different ways to do this. Right. So yeah, but no, I would say, we're telling people, we used to say you have a fever for 3 days, then give us a call. Well, that's obviously going to change now. So yeah, I think if by requiring everyone to have a doctor's note, we put one more layer in there so that we're not relying on parents trying to determine what is severe, what are severe symptoms and what are not.
Okay.
Thank you, Beth. Folks, this time next week, next Tuesday would be the second of 2 days of faculty in service. Our faculty officially are on campus or with us virtually for 2 days of faculty meetings. I would like to do my best to have another Zoom meeting. It would need to be in the evening, at least for my schedule, because during the day, I'm going to be quite busy at that time. So I will do my best to set up another Zoom meeting. This time we'll be going back to a 5:30 time. And again, it would be an opportunity for you to submit questions to me in advance and to share any particular questions or concerns that you might have between now and when we Zoom together again next week. Okay. Dr. Bawa, thank you so much for spending time with us. I really appreciate it. I'm wondering, will I eventually become an MD myself? I sure hope not. It's a lot of work that you need to do to help us understand, us lay people understand, the challenges that we have in front of us.
Don't go to medical school after the pandemic.
Again, I thank all of you families and faculty and staff who've been here as well and participated. I'm going to end the recording right now. Boom.